Okay, Zoomers, can you hear me? Okay, I assume you can. Welcome. One more story about Wednesday. How many people know the day of the week they were born? Okay, so if you come from a sort of United Kingdom style tradition, there's actually a little nursery rhyme that talks about what day of the week you're born. So Monday's child is fair of face, Tuesday's child is full of grace, Wednesday's child full of woe, Thursday's child has far to go, Friday's child is loving and giving, Saturday's child works hard for a living, but in Christian tradition, the child that's born on the Sabbath day is loving and blessed in every way, something like that. But I've always known I'm a Wednesday's child, full of woe. So every time we get these snows on Wednesday, I'm like, we're just full of woe. That's what it is. It's Wednesday. Although I do think, isn't there a new Addams Family Wednesday show that everybody loves that has a cool dance? So maybe Wednesday is going to be rebranded as being not necessarily joyful, but interesting. I'm really excited to be here with you today, even with my red nose from walking from the bus stop. I'm still a little bit cold, but I'd like to introduce to you somebody that I've gotten to know personally over the past several years now, somebody who really inspires me to want to make tomorrow better. So Dr. Haley Blackburn is a clinical pharmacist and associate professor at the University of Montana Skaggs School of Pharmacy, so one of our sister programs. Her faculty role includes teaching in the didactic coursework. She's an experiential preceptor. She works a lot in global health and in planetary health and research efforts in helping pharmacists and other health professionals develop climate-friendly, climate-forward practices. She's worked in a variety of settings in community and hospital, ambulatory care practice, and all of this together really informs the approach that she has towards this. So for those, some of you sitting out there may know exactly what you want to do next. And some of you sitting out there may say, I'm not sure what I want to do next. I hope that through Dr. Blackburn's talk, you'll be able to hear a way you might be able to fit into that. Dr. Blackburn serves as a board member of the Montana Health Professions for a Healthy Climate, and she's a co-founder of a grassroots organization called RX for Climate, and that's actually how we met. This is pharmacists from all over the United States, pharmacy practitioners and academics. We're connected to pharmacists in Canada, in the United Kingdom, and in Australia, all looking at climate forward pharmacy practice. And it is a real testament to grassroots organization. None of us knew each other at all, but we gathered virtually over, a real desire to make tomorrow better. And now I think we've done a lot of significant academic work, research work, and policy and advocacy. Her work includes ongoing contributions to the International Pharmaceutical Federation, that's FIP, their equity and sustainable policy development, the Global Consortium on Climate and Health Education, and the Climate Resources for Health Education Initiative. So just showing that what she's talking about here is actually connected to really important work that's going on all over the world. And we want to invite you guys to be part of that today too. Some of you know, at least about 10 of you know, hold up your hands if you are in the elective that Dr. Blackburn and I, hold up 2 hands maybe so people can see you. So even some of the students in our program now are already being influenced by the work that Dr. Blackburn is doing in Montana and further afield, working with an elective course that has pharmacy students from Colorado, from Montana, nursing students from Montana State, medical students from Colorado, and pharmacy students from Melbourne, Australia. So I want you to hear as she talks about networking, community building, and again, I'll say it one more time, making tomorrow better. But she's not all work and no place. In her, free time, you can find her outdoors. She's from Montana, so she thinks this is a balmy day. It's nice and warm for her. She loves to ski, hike, bike, otherwise enjoy time spent in nature with her partner and her dog. Without further ado, please join me in giving a hand of applause for Dr. Haley Blackburn.
All right, thank you, Tina. Thank you, everybody, for that introduction. I am very excited to be here today to talk to you all about climate change and pharmacy practice. And some of you maybe have never even thought about the connection between these two, but hopefully by the end of today, will be able to convince you that this is actually really, really important for every single one of us in this room to be thinking about from not only a personal perspective, but from a professional perspective. Uh-oh, that's never good. Got it, okay. So just disclosures up front, no financial conflicts to reveal. I'm not funded by Big Climate. I am, however, a member of the board of directors for Montana Health Professionals for a Healthy Climate, and also the co-founder, as Tina mentioned. I'm gonna reference these later, but I do not receive any financial compensation for any of the work that I do with these activities. So I'm not gonna go back all the way to the late 1800s when we first knew about the greenhouse gas effect and we started to understand the implications of having more carbon dioxide in our atmosphere and what that did to our overall global climate. I will, however, go to the 1990s when we had our first intergovernmental panel on climate change. And that report that came out that said, glaciers are gonna melt, sea levels are going to rise, animal habitat is threatened. And the polar bears came out and they're like, oh, that sounds real bad. Guys, that sounds bad. And we really thought about this as an environmental issue, right? But more and more in recent years, this has really been framed squarely as a human health issue. So it's not just the polar bears, we're species on this planet too. The World Health Organization in 2021, climate change is the single biggest health threat facing humanity. So this is something we've seen. We see it all over the news, different events happening, whether it is on a smaller scale, local events, heat waves that maybe only impact 1 or 2 cities, or something like the flooding in Pakistan that has just been devastating to an entire country. Ultimately, the most recent IPCC report that came out this last year really centered a lot of its messaging around health. So the 3 primary takeaways, if you don't want to read 2,000 pages, 1, climate change is not a future problem. It is already harming people's health. More urgent action is needed to prevent the worst harms. This is a code red situation right now. But climate solutions, it's not too late, and our climate solutions can be not just environmental wins, but wins for human health and all sorts of other co-benefits that go along with climate action. So this is something that we can tell this from a story of hope, not just from dire red alert doom and gloom. All of the different health impacts of climate change, I'm not going to go through all of them. There's way too many to mention here. We can look at all of these up here, whether it's air pollution, extreme heat, drought, wildfires and wildfire smoke. We're all pretty familiar with that, unfortunately, here in the Rocky Mountain West. Changes in vector ecology, food system impacts, and then mental health impacts all the way around here. Tina talked about the up and down that you experience as you maybe dip your toes into these waters and then maybe go a little bit deeper. And so this is something that maybe goes overlooked, is what does this do to individuals and the collective cohesion and mental health of communities? One of the other things that I'd like to call attention to from that prior is that this is going to exacerbate health inequities. So we know that climate change doesn't impact everybody equally. Some people experience it more than others. That includes communities of color, our BIPOC communities, our older adults, our children, our lower income communities are all exposed and experience the impacts of climate change on different levels. These are people who are already experiencing health inequity. And we're only going to see that gap widen with climate change unless we take very specific action to address it. How do we connect these things to pharmacy practice? So as you can imagine, with that giant circle of all of these different health impacts, some of this is going to be relevant to us, right? So this is just a list of my proposed, maybe some of the things that I would highlight for us as pharmacists that we really need to be thinking about. So severe weather, disasters where we have supply chain disruption, we need to respond to an acute crisis event. Maybe there's damage to infrastructure where we're not able to get drugs into the hands of the people who need them. Maybe there's physical injury, loss of life that's happening during that acute event. And then there are short and long-term mental health impacts, needs for community recovery that occur. Maybe it's heat-related illness, for which we know that certain medications increase those risks of heat-related illness. So definitely something that should be on our radar. Drug storage and stability issues during particularly hot weather. Also thinking about like air pollution, wildfire smoke. We have increased respiratory morbidity and mortality, but not only that, we know that air pollution is very tightly linked with worse cardiovascular outcomes as well. Alongside adverse fetal and maternal outcomes, pregnant individuals are particularly susceptible to not only wildfire smoke, air pollution, but heat, cognitive impacts, renal impacts, mental health impacts. All of these are emerging in our research. We also know changing patterns of infectious disease, vector ecology, and how we saw that with the pandemic, right? That we are kind of a key piece in response to large infectious disease changes. This can be our role here too. And then with biodiversity loss of traditional medicines that are potentially very important to certain cultures, as well as potentially losses of sources of new discovery if we are losing our normal biodiversity. So I'll tell you my story. I've been concerned about climate change for a long time, but I had kind of my sentinel, my index event that really galvanized me was I'm from a small town in Montana, Sealy Lake, Montana. And in 2017, just as I was moving back to take the faculty position with the University of Montana, there was a giant wildfire that happened just outside of my hometown. The entire town was evacuated. This blue star here on this map that you can see, that is the perimeter of the fire, and the blue star there is my parents' house, the place that I grew up. So it's about a quarter mile away from the fire. And I watched my community kind of in crisis. So had my parents who were there, my mom has a lung condition. I have a niece with asthma. I watched them really struggle through this experience. I also watched my dad firmly and stubbornly say he was staying with the house and he was gonna fight it with a tractor. Bad idea, Montanans are a little bit wild sometimes. And I watched all of this and just really, it really hit home for me. I think that it's easy to see climate change as something that happens to somebody else, happens in the distant future, or happens on the other side of the world until it happens to you. The other thing you can see here, this is the air quality. So this was August 2017, all of that dark purple, that is hazardous air. That's like ash raining from the sky air. And everybody in that community who was not able to fully evacuate from the area was exposed to that for almost a month. So I had this kind of dire wake-up call and was thinking like, what do I need to do? I need to like really ramp up my action in this area as a healthcare professional. I've been aware of this, I know, what do I need to do? And then I had this follow-up Sentinel event where, as Tina said, I do global health and planetary health trips with students. And in early 2018, I had the opportunity to work with this nonprofit that works out of Indonesia that actually has tied access to medical care to deforestation in a very rural part of Borneo, where there's this critical ecosystem, this orangutan habitat, that's forest, that is a huge source of carbon capture. And it was something that I got to bring students along. I got to see them interact with this hopeful story. I got myself to see this personal kind of optimistic co-benefits, look at what can happen if we address climate change, if we look to community development, if we get the right stakeholders around the table, and if we get creative with the way that we approach our solutions. What can we do with that? And so that was maybe the flip side, or the hopeful side, where maybe there's some opportunity here. Maybe there's a way that this isn't just doom and gloom and fires bearing down upon us, but this is a hopeful story that we can kind of spark people into action. So this is actually my favorite quote, tagline for climate change, is that it is the greatest global health threat facing the world in the 21st century, but it is also the greatest opportunity for us to redefine social and environmental determinants of health. So challenge, opportunity. Is it an opportunity for pharmacy? Absolutely. And I want to highlight the first opportunity that I think is out there. So this is a survey that I've done with my pharmacy students for the last couple of years, just because I've been curious, what are students thinking about this right now? I know that younger, they highlight in the news that younger generations are very concerned about this. And so I just really wanted to get a handle on this. And these were their responses. So the majority of them saying that they were at least moderately concerned about climate change and the health impacts associated with that. 1/3 saying that they were extremely concerned about it, saying that they anticipated at least moderate impacts on the health of others, moderate impacts on their own health, and moderate impacts on their professional careers. And bear in mind that there were in that 80 to 90% people who said, I am going to see very significant impacts on this. So on one hand, a lot of concern, a lot of anticipated impacts, a lot of expression here in the behaviors category of, I want to do something. I want to change my practice to reduce greenhouse gas emissions. I want to be the person who can talk to my community or my patients. I want to be part of the system that's preparing for climate change and the climate change impacts that we know are coming. However, what are the barriers that that make me not take action? And those I have circled in yellow, kind of the top responses that really kind of come around and coalesce around this theme. I don't know what to do. I'm overwhelmed. It seems way too complex. And I don't know enough. I know that this is scary. I know this is bad, but I don't know enough to know where my role actually is in this entire thing. And so I would highlight this as a call to action, both to the faculty and the audience of look at this. We have this willing and interested workforce here that they want to know more. They want to learn more. They want to be able to act. And they just don't have the tools right now. And I guess a call to action to all of the students out there too, that you're not alone if you find yourself in this camp here, but that there is, I think, arguably a lot that we can do going forward. And I want to make the argument that pharmacists are actually particularly well positioned to be champions, to be advocates and agents of change in this realm, both on the side of climate adaptation and resilience, where we're adapting and responding and preparing for the climate change impacts that we know are already here and are coming. Even if we stopped emitting greenhouse gases today, everybody just completely stopped it. We know that the half-life of the various greenhouse gases that are in the atmosphere right now hang around for a very, very long time. And so we have a lot of change that is just baked in right now that we need to be preparing for. We also know that on the other side, climate mitigation and environmental sustainability is really, really important. And I think that pharmacists are positioned squarely in both of these realms to make a huge difference. Turns out I am not the first person to say this. There are a lot of other really smart people at FIP that in 2020 put this on their pharmacy development goals, where they actually have a development goal dedicated to this, saying that we need to look forward to pharmacists' role in responding to disasters and pandemics, getting involved in environmental and planetary health, specifically climate change, and working toward environmentally sustainable health services. Why pharmacists? Well, these are all of the taglines that we talk about, right? In pharmacy practice, we're accessible health professionals. We can walk down the road to a pharmacy when somebody can't get into primary care. We can be on the front lines, educating patients, providing recommendations, all of that. We're trusted voices. I think the latest thing, we're number 4 on trusted professions out there in the United States. We're a public health workforce. We demonstrated that during the pandemic, right? Where we're out there immunizing, testing, getting people linked into treatment. We have very essential roles in disaster response. That's not a new thing for us. We have multiple roles and specialties. So we're all over the place in all sorts of different settings with all sorts of various expertise. But all of us, we kind of share this medication, this drug product expertise, which is a really, really important facet of the way that we can contribute to the overall health professions response to this. We have nursing, we have physicians, we have these other disciplines really stepping up and saying, this is important to us, we are taking action. But they don't have some of these things that we have, and so we can fill important gaps. So what are the opportunities for us in terms of climate adaptation? Health adaptation should be occurring at multiple levels. So it can happen at the community or the health system level where we're thinking big and broadly about how do we protect everybody's health. Could be an at-risk population, or maybe it's somebody that we know is particularly susceptible to the harms of climate change, and we want to really target those populations to make interventions there. Or it could be something just on a one-on-one individual patient basis in your everyday clinical practice. Ultimately, we want to reduce the exposure to climate-related hazards if we can. So reducing exposure to air pollution or extreme heat or whatever that might be, reducing people's vulnerability, and strengthening our health system's response to future risks. So thinking about all three of those things at multiple levels. Opportunities for adaptation, if we take those same things that I highlighted before and we look at like, okay, well, what can we do about this? Securing our supply chain and maintaining continuity of care during disasters, clinical triage and emergency response, maybe during that acute phase of the disaster. Community recovery and addressing ongoing health needs on the other side of the disaster can be an important role for a pharmacist. How about extreme heat? Well, there's a lot that we can do for patients just by educating them about their risks. Do they know that they're at a particular risk because they have diabetes or because they are an older individual? Monitoring medications that increase the risk of heat harms and potentially deprescribing those, making alternative recommendations, or at the very least, educating people on the ways that they can reduce their risks. This can also happen at a population health level or community outreach, public health messaging. For wildfire smoke, for air pollution. So in Missoula, we have like a wildfire smoke ready week. I don't know if you all have anything analogous here, but it's something that actually we start the public health messaging in early June. We know wildfire season is coming. It's no longer a question of if, but when. And so we start talking to people about the risks associated with wildfire smoke exposure. You can also do things like reducing the patient exposure with recommending personal air filters, or maybe even what they call clean air space. So a public space that people can come if they can't keep their air at their home clean. They can go to a community space and stay in clean air for as much of the day as they can. Increasing patient monitoring, telehealth, remote patient monitoring technologies. Are we able to maybe have one of those sensors on a patient inhaler that alerts us when somebody's overusing their inhaler during a particularly bad air quality day? All of the different things with patient education, not only around pandemic prevention, but also like, hey, there's tick-borne disease patterns that are changing, and we should be able to counsel on what those are and how we prevent patient exposure to those. I'm not going to say anything more about pandemic response, where we are all too familiar at this point of what our opportunities there are to act. So I'll give you some specific examples of what I've been able to work with pharmacy students on. So one of the projects that I worked on this last summer, as I mentioned, we have this wildfire smoke ready week. I'm part of our community climate adaptation planning committee. And I had some of my pharmacy students on APP rotation with me get involved in those efforts. And we came up with a project where we engaged with a couple of local independently owned community pharmacies to use them as a venue for some public health messaging, a public health education campaign. Students helped create some bag tags, some posters for the pharmacy, some kind of conversation guides for pharmacy staff to say, hey, remember wildfire smoke is coming, remember it's summer, it's heat, to specifically prompt people to talk about maybe an asthma action plan, thinking about how to proactively manage their respiratory condition. And then ultimately, we also collected community data to say, has anybody ever talked to you about this before? One of the things that was striking to me was that only 16% of the respondents to our survey with asthma said that anybody, any health profession had ever talked to them before about the hazards of wildfire smoke or what to do to protect their health during wildfire smoke events. So my pharmacy student here, very proud of her, presented a poster at mid-year on all of this project and did really, really great work. I've also had pharmacy students involved in some community outreach and education, working directly with schools to do an EPA flags program where you educate kids so that they know what hazardous air quality means, and they can put up a flag saying, today is a yellow day. We should be careful for, for our classmates, for the people that we know who have asthma. We should help watch out for them and make sure that they're doing okay. I mean, we can think about this as analogous to some of the things that you all are probably familiar with, and like medication safety presentations to grade school children. This could be kind of the same activity that you might think about. I also am working with a former student, now resident, on some research around medication use in those hospitalized during the 2021 Pacific Northwest heat wave. So we're looking at a large set of data, and we're trying to come up with some clinical care pathways that might help flag high-risk patients, flag maybe some deprescribing pathways as they're discharged from the hospital, maybe thinking about that on like both a research level and a systems level for interventions. Ultimately, though, we can't just focus on adaptation. That's the temptation, right? Is we've got the most urgent thing right in front of us, but we really need to think upstream. Where are these impacts coming from? If we don't do anything, that's the absolute worst outcome. If we do adaptation, we're going to decrease the harm, certainly. It's better than nothing. But the best outcome that we can hope for is only going to come from adaptation and mitigation. So what do we think about with mitigation, with sustainability? Probably the first thing that comes to mind is these big open green fields with windmills, and maybe you're planting a tree out there somewhere in that green space. What do we think about when we think about sustainability in pharmacy or in medicine? Most of the time when I talk to them, they think this, trash. I see so much waste out there. And we know that that's true. Just the pandemic alone, the World Health Organization came out with a report last year saying that their estimated COVID vaccine waste, so not including PPE, but just the specific equipment for administering a vaccine, was over 144,000 tons of waste generated by the pandemic. We know even on a routine day in the hospital, we estimate somewhere around 6,500 tons per day generated by hospitals across the United States. So a huge amount of waste coming from our clinical care. We can also envision this in pharmacy practice, right? Think of all of the things that we throw away even in an outpatient pharmacy setting. So that's the first thing that comes to mind to people. Maybe you also are like, yeah, I've heard about some like weird stuff, pharmaceuticals in the environment, that there's pharmaceuticals in our waterways. And there was a study last year also that was actually this really cool kind of crowdsourced global pharmaceutical watch, where they had testing sites. They tried to just get a sample size from everywhere, like the Amazon and the like urban areas of certain places, overall 1,000 sampling sites. And they found that over a quarter of those sampling sites had active pharmaceutical ingredients at concentrations that were either considered unsafe for aquatic organisms or concern in terms of antimicrobial resistance, so selecting for antimicrobial resistance. These problems are particularly pronounced in low and middle income countries, and some of these are really pronounced in some of our drug manufacturing centers like India, where we see really alarming rates of drug-resistant pathogens because of a number of different reasons, but a lot, we think, is driven by pharmaceutical pollution from our pharmaceutical manufacturers. So we've got that. Maybe you've thought about that. How many people have thought about our emissions from our healthcare system? Other than the 10 students in the crowd right now who have seen this very slide before, how many people are aware of the carbon footprint of the healthcare system? You might have some general sense. We know it's like a huge percentage of our GDP. We know that there are a ton of resources that go into it. But if we were to take healthcare around the world and become our own country, we would be the 5th largest emitter in the world behind China, USA, India, and Russia. So 5th largest emitter, and then if you break that down, the United States is responsible for over a quarter of that. So huge contribution to our total greenhouse gases emitted on an annual basis. And within that, we know that pharmaceuticals make up somewhere between 20 and 30% of the healthcare carbon footprint, at least in those top emitter, maybe like higher resource settings. So you can look here, Canada, China, Australia, UK, all in that range. The USA, I do want to flag that. And you can see this is the AHRQ 2022 report where they said, hey, there's 18% roughly of our greenhouse gases from the healthcare sector come from pharmaceuticals and chemicals. However, this does not quantify any of the greenhouse gases that come from volatile anesthetics, from anesthesia, from surgical operations, nor does it quantify any of the greenhouse gases that come from propellants in our inhalers. And we'll talk about that in a minute, because you probably are all raising your eyes and like, propellants and inhalers, what? We think about the pharmaceutical life cycle. We know that this is all like very resource intensive and there's all sorts of stuff that goes into it. We know that our supply chain's a little bit wild, right? And that things go from point A to point B to point C before they ever even come to a distributor to come to us. And then we know that the distribution from the pharmacy to the patient isn't always very simple either. We know that there are issues with drug disposal. We have our drug take-back events, but otherwise, who knows what patients are doing with their drugs as they maybe have unused medications in their home. So we know there's a lot that goes into this, a lot of issues, a lot of opportunities for us to intervene. One of the things that I like to point out, and there actually is an organization called Healthcare Without Harm that focuses on these, is that we have healthcare harms. We've often thought about preventable medical errors as our healthcare harms that we really need to focus on, because we as healthcare professionals are causing deaths out there. We don't capture in the conversation the deaths that are caused by greenhouse gases and air pollution emitted directly from, so this statistic looks at the United States healthcare sector, and specifically in the United States. I have not seen this quantified on a global level, but we can think about this as kind of scaling up, that this is a significant contributor to leading causes of death in our country and around the world. So in terms of our oath to do no harm, we're not doing great in this particular area. So this isn't just about greenhouse gases. This isn't just about pollution. This is about a number of different things that all feed back into human health. So we know that our healthcare system in the United States, ultimately, if we look at our total carbon footprint for our nation, our healthcare system is responsible for somewhere between 7 to 10% of greenhouse gases, 9% of particulate matter in the air in the United States, 7% of consumption of commercial water in the United States. We know there are different changes with land use. You all have a giant campus here and it's beautiful, and that's a lot of land. Impacts on ecosystems as we have pharmaceuticals in the environment, or air pollution, or changes in our biodiversity. All of this feeding back into health equity, environmental justice, all of this. So it's not, we can't just look at one individual piece here. We're familiar and we're comfortable with the idea that we're stewards of medications, right? The World Health Organization has us as those kind of the stewards of rational use of medications, where we're saying we need to steward our resources, we need to optimize patient care, and we want to be thinking not only about the individual, but the care for the community, kind of thinking a little bit about the collective. And we can do a number of things along the way that really align with things that we're already doing in terms of maybe encouraging lifestyle prescribing or social prescribing first before medication therapy, getting rid of unnecessary medication, deprescribing when possible. All of that sounds like very familiar to all of us, right? But maybe we need to also rethink the way that we approach certain things. So maybe we can preferentially use medications that have a lower environmental impact, or maybe we need to rethink the way that we package and dispense drugs. Maybe we need to use alternative types of packaging that's more recyclable, that creates less waste. Maybe we need to dispense smaller quantities of drugs up front and not give that person on their first trial of a drug a 90-day supply, only to find out 4 days in that they're having an adverse effect. And then we can also think about how we promote efforts to create more of a circular supply chain with pharmaceutical products. So promoting efforts to redistribute or donate unused meds if we can ensure that there's quality and safety standards in place for that. Is that something that we can, we know that there's a lot out there that we say, oh, it's expired, or oh, it's maybe left the pharmacy. We absolutely can't use it. We know that expiration dates for the most part don't really match up with the science that we have around how stable drugs truly are. We know also that right now, the way that we design drugs, we design devices for our insulin pens, for our biologics, for all of those are not designed with any type of circularity in mind. They're designed for convenience and cost. And so very few of these are recyclable, which generates a huge amount of waste, but could we design those better? And then ultimately, how do we keep pharmaceuticals out of the environment and have more effective methods of disposing of them? This I mentioned before, so this is the environmental impact of inhalers, and you were maybe thinking like, what is she talking about? So when we had our CFCs, our ozone depleting propellants, phase out of inhalers, that happened once upon a time. Tina has a story about it. You can ask her later. We thought we were doing a good thing. We were like, no, we don't want a hole in the ozone layer. So we replaced it with hydrofluorocarbons that don't deplete ozone. However, those propellant gases are anywhere between 1,500 to 3,000 times more potent greenhouse gases than carbon dioxide. But you think, gosh, that's like a really small volume. But each metered dose inhaler that a patient uses is equivalent to driving about 175 miles in a car, as compared to a dry powder inhaler, which is maybe only about 5 miles in a car. How much can this possibly mean in terms of adding up to our health, our overall impact on our health system? So there's a 2022 Dutch study that came out. They have about 1.4 million asthma and COPD patients who use inhalers on a regular basis. And they looked at everybody there who had a metered dose inhaler with propellant and said, hey, what if we switched about 70%? We think it would be reasonable. We exclude people that are definitely not candidates to switch over to a DPI. And then we say, okay, well, if we could do 2 out of 3, that's pretty good. We think that's doable. That would be a potential greenhouse gas reduction of taking 13,000 cars off the road every year if you were able to do that and sustain that on an annual basis. Maybe doesn't sound that impressive, but if we scaled that up to the United States, this is my back of the napkin math here, but this would equate to our 41 million asthma and COPD patients. If we did the same type of conversion, getting about 2/3 of them switched over to dry powder inhalers, that's 380,000 cars taken off the road. So potentially kind of a significant advantage. Inhalers, who knew? Overall, we know pharmacists are really good at providing and supporting the right amount of care, right? So we're really good at improving access to care, getting immunization rates, adherence, all of this together at the same time that we reduce ADRs, we reduce ED visits, reduce hospitalizations or the length of stay, improving outcomes in ambulatory care, managing diabetes, whatever it might be. All of this is associated with both us bringing up kind of the bottom, providing that foundation to increase individuals and populations' resilience to climate. Healthier people are better able to respond to external threats, while also reducing that waste, reducing that unnecessary treatment, that extra hospital stay, all of that that's very resource intensive. And we can maybe be the people to like break the cycle where we have worse health outcomes, more healthcare utilization that causes greater health and, and environmental harms, and switch that paradigm over to better health outcomes, less healthcare utilization, and fewer environmental harms. This was a paper that I liked that came out that redefined rational use. So it took the World Health Organization rational use definition and just tagged on, hey, what if we didn't just consider the stewardship thing, but we also, when we're saying stewardship, we're stewards of the environment. And so we need to consider the interconnection between people, animals, plants, and their shared environment when we are promoting rational use. Okay, Haley, cool presentation, but like, how do I actually get going on this? Where do I start? So the first place I would recommend is just talk about it. That seems maybe kind of silly, but a lot of climate experts say that that's the place to start. Talk to people around you, connect with others, You might not be an expert now. For your classmates, the 10 of you who raised your hand earlier, guess what? You're the peer experts now to talk to your classmates and your colleagues about this. And then thinking not only from a doom and gloom perspective, but what are the co-benefits? How can we align this with other goals as we take action? So talk about it. I think that there's good evidence out there that we hesitate to talk about this because climate change has been really politicized. But we also know that people greatly underestimate, the majority of people, anywhere between 80 to 90%, underestimate the concern of those around them. And that can perpetuate kind of this silence of like, well, the smoke in the room must be okay because no one else is talking about it. However, evidence shows that there are a lot of people out there around you that are concerned. So if you speak up, you're likely to find allies and peers. Speaking up doesn't have to mean that you're speaking from an area of expertise. You can just say like, hey, I don't know about this, but I'm kind of worried about it. When, you know, like, I'd like to learn more about this. These are some great resources. There are more and more every day that come out. Really, really accessible. These are my recommendations, but tons more for you to potentially peruse and kind of gain some familiarity there. Opportunities for action exist all across the spectrum in all of these different roles. So regardless of where you think you might be going with your career, you probably have an opportunity to play a role in climate adaptation and environmental sustainability within pharmacy. Ultimately, make it personal. So this is my cheesy thing I tell students, but I think that there's some value in it. To find this is your climate action Venn diagram. So what are you good at? What are your skills? What do you like to do? What can you influence? Where's your sphere of influence? Like, are you a community pharmacist? Are you going to be able to influence drug design? Maybe not. You may be too far removed in like that initial sphere of influence, but that doesn't mean that you don't have an important role to play. What are you interested and passionate about? You're not going to sustain your action if you're not like really into it. And then what is actually needed? So for me, my climate diagram, I like to tell myself I'm a good teacher in the morning, every day in the mirror. I am interested and passionate about climate change. I'm interested and passionate about education. And based on those survey results, there is a need for education. And so that was kind of my climate Venn diagram where I decided to really step into that role. Ultimately, find your place, find your people. Look and connect. That is the only way that we're really going to move the needle on this, is to create community, create maybe bottom-up efforts. We can't just wait for top-down efforts. So look around the room, find your allies, and ultimately do what you can to support each other in these efforts. This is just a final plug. Tina already plugged it, but if you, thank you, Tina. But if you have not heard of, but you're interested more in learning about our network, RX for Climate, it's just rxforclimate.org. Go check out our website. There are students involved. It's not just practitioners. It's not just educators. We have a student representative on our leadership team, a lot of really great students who are engaged in these types of initiatives, and a lot of opportunity for you to connect with others who maybe share similar concerns or just want to take action in some way. That is all I have. Please, please, please feel free to reach out. I love to be accessible. I love to talk about this more, hear your ideas, hear your concerns. So you can email me, come find me afterwards. There's my very long and exhaustive list of references, and we don't have a ton of time for questions, but I am happy to take any from the audience. Question right there. Mm-hmm. Mm-hmm. Yeah, so that's a really good question. I think that that comes from a number of different places. So right now at the higher level top-down approach. We have regulatory agencies. We have Department of Health and Human Services in the United States having this health sector pledge for climate action, and they're moving toward regulations and even payment structures that would hinge on environmental sustainability. So conversations happening in JCO and CMS and everything that might push, it's kind of that like payer, that push incentive. And then I do think also you all as pharmacists, patients, people on the other end can create some of those pull incentives to say, hey, this is really important. Like how many patients are going to ask you for a dry powder albuterol inhaler right now, or how many pharmacists not knowing this are going to ask for this? But as soon as you start having these conversations more and more. So I think that there's top down and bottom up approaches to influence that. Any other questions?
Do me a favor, close your eyes. Raise one of those hands if you're personally concerned about climate and health. Okay, lower your hands, open your eyes. A lot of hands up. A lot of hands up, guys.
I can, she's not lying. It's true. A lot of hands. Yeah, I mean, talk to your peers about it. Talk to your, raise your hand, the 10 students who are in the elective right now. Okay, I've got you all marked and I'm mad at you if you don't come up and say hi after this. But also, yeah, look at their, you know, like, sorry, all you're now the climate champions. You're the ones that can talk to your peers about this, but everybody here can really be that person.
All right, thanks, Dr. Blackburn. A lot of food for thought, right? And a lot of potential for us in this room to really create change. So I hope you guys have learned a lot from this. Appreciate you guys again for being here. You are now dismissed to go to class. If you are heading home, please drive carefully, whether you're going home now or later, and have a great day. That's amazing. Simple work. Things you don't really, yeah, people don't think about it.
Right. Yeah, no, it's as soon as you like step down the rabbit hole.
Yeah.
It goes steep.
Yeah,
It goes
yeah.
steep.
I can see, you'd be like, whoa, that's so cool.